PCOS stands for Polycystic ovarian syndrome. Okay, so it's a very common condition among women, especially the young ladies. Okay, the college going and in their early 20s, like that. Okay, so in PCOS, there is no normal ovulation is occurring. So there is impaired ovulation, and along with that, there is impaired hormonal balance. So the basic pathology is like there is insulin resistance. So you know that insulin is a hormone requiring glucose metabolism. So there is insulin is there, but there is resistance. So its action is impaired. So there is more insulin in blood, also more glucose in blood. So the excess glucose is converted to fat. Okay, that is why you are getting overweight. And more of insulin, it triggers the testosterone production. You know that testosterone is a male hormone. So more of testosterone. So what happens is that excessive hair growth and all. So the first is irregular menses. So what happens in PCOS is that you may be having prolonged periods. That is, you may be getting your periods in 45 days or up to 3 months, once in 3 months or 6 months. So it's a prolonged period. The second is, of course, most of the PCOS patient is obese, overweight. And then, of course, there is hormonal imbalance. So as a result of it, you may be having that oily skin, a lot of pimples, then some dark pigmentations over your neck and upper body. Then you must be having that excessive hair growth. And of course, one other symptom is infertility. PCOS can cause infertility also. So with these symptoms, we have to examine the patient, then history, clinical examination. Then to support our clinical diagnosis, we do some investigations like ultrasound. Okay, that is a basic investigation which we do. In that, we can see that polycystic ovaries, that is multiple small fluid-filled spaces in ovaries can be seen. Okay, that is a USG, and there are different diagnostic criteria for that. And of course, sometimes we do the hormonal test like LH, FSH, these are all female hormones, and also we do the testosterone levels, we do check. And to rule out other causes, because especially in delayed periods and all, one may be that hypothyroidism may be a cause. So we have to do that thyroid function test. Then sometimes we do that prolactin test also. So these are the basic tests which we do to diagnose the PCOS. More of treating the symptoms, and we are treating the complications. We are preventing the complications to occur. Okay, so the first and foremost is lifestyle modification. It's not about drugs, it's all about lifestyle modification. Because when we discussed the pathology, we told that it's overweight, there is insulin resistance. So we have to treat that. So the first thing is that you have to cut out your diet. Okay, so you have to reduce your carbohydrate intake. You have to eat more of nutrient-rich diet like fruits, vegetables, and you have to take a lot of antioxidants. Even the 5% weight reduction can give you magnificent result. Then you have to exercise regularly. So the exercise is, of course, to lose weight, and more than that, if you exercise regularly, of course you know that endorphins are getting released, and it is good in regulating the hormones. Okay, so you have to at least for 30 minutes you walk. So we put on supplements and metformin for around 2 to 3 months we start, and along with the lifestyle modification you can have definite effect on that. Okay, and if it is not, if you are having excessive hair growth like that and your testosterone levels are more, and if you are not responding to that metformin tablets, that is a first line management, we can start you on hormonal tablets. Okay, that means it's like about controlling pills. So the same is there, and along with that we are giving you estrogens, and along with that another drug is cyproterone acetate. It will help you to regularize your hormonal imbalance, so that the increased testosterone level is decreased, and that it will help to regulate your periods and also to decrease the testosterone levels. So it will help to reduce that excessive hair growth also. Long term, what happens is that there is an impaired glucose metabolism, so that can lead to diabetes and also hypertension, and together long term diabetes and hypertension can give you cardiac diseases also. So that is a long term complications. And more of it, if you're not having periods regularly, that is very delayed periods, there is more chance of a uterine cancer in long term. That's all long term complications. So if you are diagnosing PCOS on time, and if you are treating it, we can prevent all these complications.